Okay, so a very good morning to everyone who is joining us on Air Meet. Very thankful for all of you for making the time out to really join us for this very casual fireside chat. And we are very honored to have three of our wonderful panelists here with us, representing all the different segments of the healthcare spectrum, to really share their experiences and stories with us around the topic of Ikigai and career passion. We really want to deep dive with them into how they decided to get started in their careers, and how they have really pushed forward in their different specialties to where they are today. So I'll just introduce them one by one before we kickstart with our primer questions proper. So I would like to start with our steering committee member, Dr. Noel. So Dr. Noel Yeo is the Chief Operating Officer of IHH Healthcare Singapore. And prior to this role, he had served as the Senior Vice President of Parkway Hospital Singapore in 2020 and CEO of Mount Elizabeth Hospital since 2017. So he began his private practice as a family physician and designated workplace doctor at Healthway Medical Group before entering healthcare management as business manager of pediatrics. So later he started Healthway Mobile, the ambulatory medical division. In 2013, he left Healthway to join Mount Elizabeth Hospital, and he also serves as a volunteer on the Central Singapore Community Development Council, the Singapore Medical Association Complaints Committee, and the Society for the Aged Sick Executive Committee. So that's Dr. Noel's introduction. So now I'll proceed on to introduce our other two members on the panel as well. So with us, we also have Dr. Zhou Wentao. So Dr. Zhou is a senior lecturer and program director of the Master of Nursing program at the Alice Lee Center for Nursing Studies. A registered advanced practice nurse at the Singapore Nursing Board, she also holds a joint appointment with the National Neuroscience Institute to provide care for neurodisabled patients in the community. So we're also very happy to have her with us to offer her a very specialized experience in as a nurse, practicing for so many years, and also with her education of our next generation of nursing practitioners. So finally, we have Mr. Sean Ang, who is definitely not your traditional pharmacist. So we first heard of Sean through his YouTube series Life, Love and Lipidemia, where he speaks with many of our pharmacy professionals in the industry as well as in the private and public healthcare sectors, where he really dives deep to understand, what are some of the stigmas surrounding pharmacy, the challenges they face, etc. And so we really wanted to invite him into this session to really speak about the intersection of healthcare and mental wellness, which is a key topic that we also want to explore in today's fireside chat. So in 2014, he founded Success Alliance Enrichment as the founder and managing director to work with the government and private organizations who want to enhance mental wellness and reduce healthcare costs by building mental health competencies, especially in our youth. And they have now worked with more than 70 organizations and impacted thousands of individuals through their programs involving smoking cessation, youth peer support, and mental wellness. So we also, so I see that Sean has actually accidentally dropped off the call for a moment. So while we wait for him to come back into the call, maybe we can start off with a quick introduction from our two panelists who are here with us now. Maybe do you want to share a few words to start off our fireside chat? Dr. Noel, maybe you want to start off?
Sure. Thanks, Joel, for your kind introduction. I mean, when I sent in my bio, I didn't expect you to read off everything. but thanks again. Also happy to be together with the rest of the fellow speakers, are very esteemed people with established careers. And I'm looking forward to having this conversation with everyone here. I think there are lots of learnings that we can have and exchange with one another. Certainly will share my story of more of failures. In fact, I think my story is more about failing than success. And I know it's not the typical kind of story that you like to hear. But let's make this fireside chat as realistic as can be. Thank you.
Thanks, Dr. Noel. Dr. Zhou?
Thanks, Joel, for the introduction. I think it's again, similarly for me, it's a learning journey. which I'm glad I'm joining this. I have attended a few series. I have learned a lot of things from this beyond healthcare, or health hack. So that is still new to me. I'm learning. But however, I think for today, I'm going to share is really something I'm learning along the way, which I'm still learning. Yeah. So I really hope to discuss with the other panelists to gain more insight from that. Yeah. Thanks.
Thanks, Dr. Joe. I see Sean is still having some difficulty joining back. So in interest of time, we do want to kick off our panel discussion first. So maybe we can start off with our first primer question, which is, in the course of your long career so far, do you have any memorable events where you feel that kind of your personal passions and satisfactions have aligned perfectly with your current job in healthcare?
Joel, this is directed to me or directed to
I
Dr.
think
Cho?
I think it's directed to both of you. Or I see Sean has also joined back. So anyone can feel free to just jump in with your stories first.
Maybe Noel, you start first.
Hey, Dr. Cho, I thought I wanted to ask you to start first because you're the lady here. But okay,
I think you have more story to share.
Sure. I think well, maybe just give everyone my personal approach towards Ikigai. I think you all know, right? What Ikigai is about now. You have to balance a couple of elements and find balance. I think for us, basic. I started at a younger age trying to understand what is Ikigai. I mean, I never knew all these things, right? Nobody taught us. So for me, very simple. I just wanted to balance my talent versus passion. So I went on a journey to find out what I'm good at and what I like to do. And I find that if you are able to match your talent and passion, then in general, you're on the right track where you'll be on this, what I call path of least resistance to building your career and achieving so-called success. So that's how I approach it. Personal passion, I don't quite have many things. If you ask me what my passion is, right, is essentially I just want to have relax, have a good life. And it's up to you to define what your good life is. But at the same time, I also want other people to have the access to a good life. I mean, when I say good life, I'm talking about balance, physical health, social, have lasting relationships with friends, family, have a peace of mind, have hope for the future, and a career that you can be proud of. And that's what I meant by a good life. So I thought that I wanted to, when I finally realized and find out what this good life means to me, I also want to share it with other people. So for me, it's a very simple thing. I don't have that kind of big ambition, so and so forth. And if you look at my LinkedIn page, you will see that I introduced myself as a healthcare leader, a change maker, and aspiring philanthropist. So that's really what I aim to do in this very short life. I'm already lived half my life already. So I think I probably have another 40 years more to go. So all of you should start thinking very, very hard what you want to achieve with this life. It's very, very short, but make sure that you live a quality life and a meaningful life. And I think meaning is found in when you fill your life with positive emotions. And for me, the two most positive emotions will be love and gratitude. So when you fill your life with that, you have a very satisfying career, personal life as well. Okay, over to our lady in the house.
Thanks, Noel. After listening to what you have shared, life is really short. Yeah. So I start, maybe just give a little bit background. Actually, I'm originally born in China. I came over at about age 18. That is starting my nursing training at NYP. So throughout the past almost about 23 years, I came in, 27 years, I came in 1993. So all the while, I think the whole thing moved me on is learning. Yeah, I have never stopped learn from the diploma days, move on to degree, to my master, and did my PhD, and currently teaching at university. I think is in different stage, I kind of have different passion, have a different aim till today, I do not know what exactly is my passion. I think I choose a correct profession, which is healthcare. All the while, I think that is also due to the family background. My mom's side, most of them are in healthcare. So in my mind, it's very narrow. I only know there's one career when the time I'm young, it's called healthcare. So that's why I stepped into this profession. So if you ask me what is my passion, till today I'm still searching. I think whatever things make me excited, I feel, oh, is that my passion? But once I mastered that, it's kind of, I settle it down. I feel, oh, then what is next? So I'm so glad along the journey, I have met a lot of, I must say, passionate people, stimulated me and make me grow along the way. I think the people surrounding you are very important. So the culture you are putting yourself into is important. I think that passion sometimes may not be similar as talent. Talent is something born with, or some people is just so talented in certain things since young. But passion is kind of need to take time to nurture, and you need to searching for it. I think I'm still searching for it, despite gone through the clinical nursing and doing the clinical teaching. I became an APN and start to actually do a small portion of what is the medical doctors are doing. Now I move on to teaching and doing research. I'm still searching exactly what is my vision or mission in life. Still searching. Like just now, Noel say the life is short. I'm counting down how many years I'm still having. So I hope I can find it and contribute back to in my best ability. Thanks. Talk a lot. Thanks so much.
Thank you, Dr. Zhou, for that. Yeah, I think from us sharing from Dr. Noah, Dr. Zhou, I really think that that whole concept of lifelong learning is something that also like everyone keeps telling us, like as students now, your learning can't just stop once you finish university or finish your education and move on into work, because it's always that continuous process of growing and developing, right? So maybe like I would say, particularly because for our young students who are maybe graduating and just stepping foot into the workforce. And I think like one of the reasons why we wanted to hold this fireside chat as well is because we are starting to hear this thing about burnout. And I think maybe I would say for myself, when I speak to my other friends who are already junior doctors, junior nurses, etc., they're starting that transition from studying into really full practice. They say, oh, like maybe don't join medicine, don't join nursing, don't join pharmacy. It's too much work. I didn't expect that it would be so much. I have that mental burden on me. How would you try to encourage these young students in trying to advance in terms of their motivation and finding that passion for their work?
Okay, so I will go first, and I think let's address the first thing that you mentioned, which is burnout. I think let's have a realistic approach to it. We may not know that it happens to us, but I firmly believe that all of us, if not everyone, would experience burnout some point in their life. It can be burnout at work most often. It can also be burnout in relationship. Right? It can be burnout with personal matters. So we have to be very realistic about it and know that it's something we can't avoid. Later, I think Wen Tao can also elaborate further. Now, the second thing about how to then address this potential problem and build your so-called your career or your life, right, is to be prepared for it, is to plan ahead and to have priority in areas of your life that you want to work on first. And I would strongly urge everyone to follow the discipline. In the case of how I did is that I always set myself a 1-year plan, a 5-year plan, and a 10-year plan. So every year I will always update and reflect on what I've achieved over the past 1 year, and then I move my my plan ahead. So I will keep updating this plan, and I will find out how much and rate myself and see how far I progress along the way. And in my sub-segments under the 1-year plan, 5-year plan, 10-year plan is what I mentioned earlier about what I prioritize in life. I always have a few quadrants, physical health being one, social being second, financial, I also put it as one of the important parts of my life, career, spiritual health, and mental health. So these are the few things that I will always plan for for the next year, for the next 5 years, for the next 10 years. Over to Wentao to elaborate further.
Thanks, Noel. Yeah, so I think the transition is very important from university to society. Your role is changing. You are no more purely being protected. It's somehow you will face some challenges. I think sometimes the society is, yeah, we have a lot of people burn out, but what we are amplified or overlooking at that, sometimes we need to really teach the youngs how to handle that. There will be no smooth journey. I think in the past, maybe still not so bad, but I think come to this era, it's going to be a turbulence everywhere. I think we all the graduates need to learn to how to face all this turbulence. To really share my 2 cents worth is really when the time you step into a working environment, you must learn to be humble, to respect. And the most important things I feel is observe and reflect. Why people doing things in that way? I feel that is what I have learned along the way, especially when the time I just came into Singapore, my language may not be that strong. Sometimes for me to express my ideas, there's some challenges. So I really, it's a period for me to be observe how people actually express themselves, how people handle certain things. So I reflect why they do in that way. So I think this is a very powerful way for our youngs to grow up. That is just my experience. I thought to share with everyone and hope that can be helpful. Definitely you will face challenges, and till today when the time I moved into a new environment, sometimes I also feel why like this. But when the time I sit down and think, I reflect why the person says in that way, so it's always make me feel better. Yeah. So I think that is my thoughts. Yeah, thanks. Maybe we can pass the stage to Sean.
Yeah.
Hey everyone.
Thanks, Sean. Glad you could join us after fixing your cable issue.
Yeah, I broke my camera cable. Had to find another one.
Yeah, maybe just to jump right in, the question we're tackling is about the burnout of healthcare professionals, especially among our junior doctors, nurses, and pharmacists, when they just move from graduation and then into the workforce, and they say, you know, like, I didn't expect to be have such a heavy workload. I didn't expect to have this heavy mental burden on me in the workforce. So how would you try to encourage them, or what any personal experience with that in your journey?
I think first of all, it's about managing your expectations. I think if any healthcare professional comes into the profession after graduation and you think that life is going to be easy when you try to pick up new knowledge, new skills, not going to happen. Yeah. So if you manage your expectations, then when something comes and it hits you hard, you realize, oh, okay, I kind of expected it. It's not easy, but I kind of expected it. Right. So that's the first thing, managing your expectations. And I think the next thing really is understanding how do you cope with difficult times. I think it is normal to be stressed. I face the normal work stresses that I think everyone else faces, deadlines and projects to meet. But I very seldom would crash and like go into a total state of it totally disrupts my life and you crash totally, right? So I think once you're able to discover how you manage that stress, know when is the breaking point and learn to take a step back at the correct time. Yeah. And I think that has worked very well for me. Sometimes people ask me, oh, what do you do when you have like so many deadlines piling up, and you're really stressed and sometimes you have so many things and you just don't really know what to do, right? And I tell them I just go and sleep. I sleep and I wake up, and it's not so much just resting, but rest gives you a clarity of mind. And that allows you to tackle the most important things first. That's where you have to prioritize. Yeah.
Yeah. Thanks so much, Sean, for your input. I think that really, yeah, that concept of how you manage stress, right? And I think maybe that kind of brings us into a kind of very apt topic for today's times, which is, I mean, the most stressful thing that almost everyone can attest to would be, you know, the COVID-19 pandemic, right? Which we are all still living in. I think a lot of us wouldn't have expected that it would last so long since the circuit breaker. I mean, the circuit breaker has been about just over a year ago already, and it seems like a fever dream in a sense. So I mean, in especially in the line of work of healthcare, I think especially at that point in time, a lot of people would say, you know, the healthcare sector was definitely kind of overwhelmed in a sense with the amount of you know, that was when the sector really came to the focus of the Singapore population. And I think not only in terms of the amount of work that you would have to do in terms of the institutions, but also, I mean, with how the Singapore population, you know, it's been recorded in the news how they were treating healthcare professionals. I would say it was definitely also a very stressful time for all of you, right? Or maybe you have a different experience that you can share. How has the COVID-19 pandemic kind of affected the way you work, or has it affected the way that you view your work?
Let's Sean, why don't you go first? Because Wendell and me have been talking a lot from earlier on.
COVID-19 for me, I would say it wasn't as big a hit on me as it had on some of my friends. And that's because a lot of them are practicing in the hospital. So they bear the brunt of everything that's happening, right? Sometimes it's patients who come and they are more frustrated. Sometimes it's because there is a sudden change in operational processes that doubles your workload with no increase in headcount, because it's not that easy to just increase one headcount. For me, doing the work that I do, a lot of our programs had to be shifted to virtual. So I just told myself, okay, you know, if this is the situation, then what can I do about it? Right. And then one of those things that I used to tell my students and people who we mentor is, if you ask yourself the right questions, you get the right answers, right? If you feel sad for where you are right now, then yeah, that's where you will be. But if you ask yourself, you know, what can I do about it? Then things will be slightly better. Everyone is affected in some way by COVID. Some of my friends who feel the most restricted are the ones who enjoy movement, they enjoy social life, and they found it a little bit more difficult to adapt to a virtual kind of setting. Yeah, so I think one of the things that gave us comfort initially is because me and my friends, we have Zoom dinners. It was never a thing, right? Zoom dinners. And then suddenly Zoom dinners became a thing and everyone had their food and we were just chatting over dinner. So I think that helped us cope a little bit. But I think that being in front of patients is not easy because people tend to fear what they don't quite understand. And a year ago when circuit breaker was there, no one really understood what was happening. Nobody understood the virus as much as we do right now. And there was no clear solution at that point. So I think from a healthcare professional's perspective, if you approach it with empathy, understanding that, you know, this is how your patients feel, and you will understand why they are frustrated. And lots of the time when people are upset, they're not really pissed off at you. It's the situation and the environment which is not under your control. So if it's not under your control, yeah, why worry so much? Just deal with it. Yeah.
Wentao, next.
Okay, thanks. I know you will say that. Thanks. Maybe I will share the challenge which I faced during the COVID period. First, I will share from the clinician perspective because I'm doing community care for Parkinson patients. At that stage, suddenly, whatever the plan ahead arrangement to visit the patient is being shut off. And some patients actually, you know, Parkinson patients, if they do not take their medication properly, the signs symptom may not be well controlled. On top of that, the medication bring in another set of complications. So that is the time actually we do see the hopelessness of the patient outside in the society, but I think hospital adapt fast enough. The tele consultation cut in about 2 months down the road. They quickly actually help all these patients outside there, which that is the part the hospital staff actually face a lot of uncertainty. Changes is just updates. I think every not 24 hours, 12 hours, there will be some change. I think it's very frustrated, but yet I must salute all our healthcare providers. They are doing well. At that moment, they're just like soldier to fight for a war, which is no direction, no answer, clear answer for that. So I think we handled well for definitely for healthcare sector. But however, that is what we've been trained to be. We train to be a lot of uncertainty. We train to be find out what is exactly the problem. So I always feel that is part of our role. So another part is as an educator, it's come in, we cannot have physical class, although online class or this so-called virtual teaching, it's been discussed for ages. Things is moved so slow. Yeah, in early 2020 January, actually, we pilot a class online. The students give very negative feedback. In February, the whole thing kicked in. It's suddenly everybody have no choice, need to buy in. I think COVID brings something bad to the society, but yet brings something actually good in the way, let us to reflect the way we are doing things, whether it's sustainable or not. So we quickly change everything online. And although we do have students, because we're handling a lot of mature students, they may not be tech savvy, we give them support. And we did our first online OSCE assessment, which is really a lot of preparation work. We have plan A until plan F in case there's something happen. But we did it. So look back, actually we did it. If we have a good team and the whole team work together for a same aim, I think we did it. But the whole thing is really give me challenges to really look and reflect what is a healthcare should be in the future, and how much care should be carried out in the hospital, how much should be shift out from the hospital. And I always use the holistic care model for a person's care. It's about only 20% or 30% for medical treatment. Beyond that, it's about 70%. The human's healing power is very strong. How we can enable and enhance that, I think is our next move. So that is what my sharing and what I have learned from this COVID challenge period. Yeah, thanks. Thank you. Yeah, Noel, it's your turn.
Thank you. Okay, I'll wrap up to say that one of my main reflections over the last 2 years would be that at every crisis always lies opportunities. That's one thing it came to fruition during the pandemic. So from two perspectives, one is from an organization's perspective, the other one from personal perspective. So I start with organization. So our organization was activated to support the nation's COVID-19 response. It started in January. I recall that my organization was asked to stand up screeners at the land and sea checkpoints on New Year's Eve, Chinese New Year's Eve last year. And because it was the New Year period, we have a majority of our staff, Malaysians and the Chinese, they have gone back home for the celebration. So we have a shortage to deal with. And at that time, we had to activate people who are administrators. So like me, I also went down to become a doctor assessing patients coming in and out at the ferry terminal. I also went to be a screener, temperature screener at Woodlands as well as Tuas checkpoint. So it was quite an eye-opening experience because I haven't done that for quite some time. I mean, I've already became a full-time administrator for about 5 to 6 years before I stopped all my practice. So it was a period of time of turbulence. Then after that, the opportunity starts to build up. We start to change the way our lab is being done. We introduced automation. We started to put in more PCR machine in March last year, and to date, our Parkway lab is now supporting about 15% of Singapore's testing capacity for PCR. And in addition, we also started to create COVID-19 wards in our hospital to help NCID for them to decant stable patients over. Then one of the biggest project that we got involved was the setup of Expo community care facility last year, 10,000 beds total. It was probably the biggest facility. And we got it up within 1 week. And then over the next 1 month or so, we built up that facility from the first 640 beds to about 8,000 over beds, and reaching 10,000 at some point before we handed over. So there are a lot of these things that we were involved in. So that's the organization's perspective. Personal perspective, quickly, is to tell you that during this period of time, I also found that various volunteer organizations required support. They were having trouble because of the changes in the policies, because of the infection control knowledge that's required. So I went in to volunteer my time at certain nursing homes. And then I also started to give public education talks. So I went on this journey to go out to support People's Association and various other agencies, both virtual and physical talks. I've done about 30 over so far, and I did about half in Mandarin. I've never done talks in Mandarin before because it's so difficult for us. We are all educated, maybe not, exception is Wen Tao, but for us, we're educated in English. So our medical terms, scientific terms were all in English. Then when when the grassroots people asked me, can you speak in Mandarin? Because at that time, remember early January, we had to vaccinate the healthcare workers, and we started off with 70 and above before moving now to 60 and above. They were having trouble trying to engage all these senior citizens, and they needed doctors and nurses who can speak Mandarin and give talks in Mandarin, because the engagement will not be so high if you can't do that. So I had to go and learn how to use deepl.com and Google Translate, and then come up with a script on how to give a COVID-19 vaccination talk in Mandarin. Then now everything is in my brain, 10倍 already. And now it becomes natural, 自然了. So now I can give a talk in Mandarin very comfortably, something I'll never be able to do if I had not pushed myself to do so. So like what Sean Wentha has said, that there are opportunities of growth during a pandemic, and so we must be optimistic. We must look towards a brighter future and find all these chances for you to get better. Thank you.
Thanks, Dr. Noah. Thanks to all our panelists as well. I think really very comprehensive, looking at at a personal perspective and also from your job perspective and organization as well. And I think like one thing that really came through is how do you make the most of uncertainty, right? I think that there's a common thread to everyone's like sharing. And maybe like with that in mind, and understanding that many of you are like educators and mentors as well, maybe we could ask, from your perspective, are there certain things in your profession that is very difficult to emulate in a training setting? Like what can you not train in university or in your training institute that will become essential when moving into your workplace? And I think especially now in a virtual setting, does that even change even more? Yeah, so open to anyone to start off.
Okay, I go first. So now we go reverse. I will say that a few things that when I transited from university in med school into working life, right, very immediately I found that I was very deficit in soft skills. I was really deficit in it. I couldn't communicate very well to patients. My language skills were poor. Can barely get by with the Hokkien and the Teochew that I can speak. Mandarin also not good. So that is one of I find that it's a fundamental issue that we should be addressing. And earlier on, I already shared my story of how I pivoted to be able to give talks in Mandarin. So likewise, I think we need to brush up on these areas. So soft skills, not just comms, but also earlier on, I think Sean mentioned about showing empathy. And showing empathy also is something that you can learn. Some people are naturally they are much more empathetic, but it's a skill that we also can build up and learn along the way, which I find that we in med school, maybe in nursing school and pharmacy school, we have only very short modules, maybe 2-3 days, where they teach you how to talk to people and how to address patients. But these are problems that happen every single day. So when I started working in my first week, I already offended some patient. I don't know how to deal with patient complaints. I have no idea because I was never taught the skill set. I don't even know that you must listen first, then you must apologize, then after that you must take action to show that you want to make amendments, then finally you must delight them. I never have all these framework given to me. I learned all these things only along the way in experiences and also learning from past mentors. So I think soft skills are a big area that the schools can do much better. I'm sure they're already putting more focus, but perhaps having more people like Sean and Wentao who have both academic as well as practical experience to share or to educate people. I find that this would be an area of improvement that we can make. I think I'll leave the other areas to Wentao and Sean to talk about.
Okay, Sean, you want to go first?
So I think one of the things that I found challenging is, of course, the communications bit with patients, because sometimes they don't tell you enough. Sometimes they tell you so much that you don't know what is important and what's not important. Yeah, and if you come from the perspective of providing a good level of service, I think one of the things that I found very difficult to read was how much does a patient actually want to know? Because in pharmacy school, we always tell people that, oh, you want to empower our patients and stuff, which means you want to give them information. But for some people who want to know a lot and you tell them one tablet 3 times a day, they'll tell you that's lousy service. If for somebody who wants to know, like, on the other side, they want to know very little, but you tell them the whole mechanism of action, they'll say, that's rubbish, don't waste my time. So I found that difficult to read. And after a while, what I realized was the value, I think, in the pharmacy world is not so much just dispensing medications. What I found difficult, or what I realized from the patients that I spoke to was, at some point, I think most people will be able to read a medication label. They'll be able to read a medication list. Some people, of course, will have challenge, definitely, right? But most people at some point will be able to. I've always found the most difficult thing is, how do you inspire somebody to actually care about their health? Because if they care about their health and there's a motivation from inside, then they will find out from you. They will find all ways and means to understand how to take the medicine and what are the effects on them and what's the effect on their lifestyle. Right, so that's something I didn't quite learn in school, which is how do you inspire people, right? Rather than just tell them the drug name, the side effects, how to take the medicine, all that is, at some point, I think robots can replace. Yeah, so that's one thing I think it's not easy. And when I speak to some of my pharmacy friends, they're like, yeah, we should have gone through psychology classes in pharmacy school. But I spoke to some of the professors in the past, and they're like, how do we teach people this communication bit and important bit, right? Every time we tell them that, oh, we want to put in communications bit, and then the end of semester, the feedback comes back, oh, you give me more hardcore pharmacotherapy. So it's how do you instill the importance in students? I think they are working towards it, working towards a lot of interaction with professionals, and on platforms like this, where you get to hear from all of us on the importance of communication. Still some way to go. And I think one of the things that school doesn't actually teach you in the actual curriculum is, how to be resilient, how to be adaptable. I picked up all those things by joining activities outside of academic life. That's where I learned the most, actually, I think.
Thanks, Noel, and thanks, Sean. I think they have covered definitely some very important and essential points: communication and also respect. As the most important is really to empower and to stimulate the other party to be take responsible. I think that is the key point, which both of them have mentioned. But however, which beyond than these 2 points, I feel the training, the education, we are still in a way to use certain score to say, oh, this is good, this is no good. Moving forward, I start to realize the government is also shifting that. And for healthcare providers training, we are shifting that as well. Of course, score in certain ways to give students a evaluation or benchmark to see where they are, how can they improve. But there are really things beyond that, which means personally, I feel the academic or the training should be beyond than just university. It should be very closely collaborate with industry, and to let the students step into the reality as early as possible. Because if they do not go into that, we train them so many things. In fact, the healthcare setting changing so fast. Year one, we train them for a certain package of knowledge. By year 5, whether it's relevant or not so relevant, we do not know. So if we can let the early phase to let them go out to step into the industry and start to learn in the clinical setting, I think that is the important things to train our students for the communication skills, for the determination, and to say actually not all the physicians have never made mistake. Actually, some senior physicians have gone through the mistake and learned from the mistake and become a great physicians along the way. So I think that is hard to train in the classroom. What I want to emphasize, there's something is really hard to train in the classroom. We should really collaborate with industry partners to train our future healthcare providers differently. Yeah, I think that is my perspective.
Yeah,
Thanks.
thanks for sharing, Dr. Zhou. I think like we also have a question from the floor about I think what you've kind of addressed, and also previously when you talked about holistic patient care, right? So you know, when you talk about how can we work towards achieving it while building up our competencies as well as future healthcare professionals, how can we kind of apply that to our lives right now in preparation for what is to come?
So I always, when the time I talk about this point, I always turn back to myself. If I fall sick, I only look for medication to kill my illness. I think I look beyond that. I look for somebody I love, or they love me, to be around me, to give me some social support, psycho support. And I really hope I stay in an environment, a much soothing environment. Is not so chaos, a lot of things to my uncomfortable, even worse. So I hope have a good environment. On top of that, I also hope I do not have financial burden. I do not want, because I get sick, the whole family carries the burden. So there is really beyond the just medication treatment. This is the part, if you ask me, which I would like to have an ideal model of healthcare model, which really beyond the medical treatment, and also looking at the other factors to help me heal from my illness. So if we put ourselves always in that shoes, I think the service we develop is not just one portion. We will be more holistic. I think in that manner, we will more willingly to collaborate. We know we only can do so many. So we would like to work together with other people to look into a bigger service to help the patient. So back to my philosophy, whatever we build today is for tomorrow, we are for us to use. So if we didn't build it well, then we will suffer from it. We should not complain about it. So that is what I feel. So we need to
Yeah.
work hard for what we supposed to be have in the future. Thanks.
Yeah, definitely wise words from Dr. Zhou. Dr. Noel and Sean, do you have anything to add? Any other wise words and nuggets of wisdom?
I think probably not something that is new, but many of us would have been taught by several professors in whether in med school, pharmacy, or in nursing, is to always give the care to the patient as though that the patient is your own parent, or when you see a young patient, as though this is your own child. If we can always have this mindset and carry it along with us throughout our careers in healthcare, then you will know that you will be able to deliver the quality of care that you want for your loved ones. So like what Wen Tao has mentioned earlier, you're building the healthcare for the future, because next time when you are aged and you are sick, this is the healthcare system. These are the kind of values that you want your healthcare practitioners to embrace and to apply that onto yourself. So likewise, maybe in the younger years right now, we can just visualize all these patients as our own loved ones, and give them the care that you want your own loved ones to receive. Thanks.
I think one of the very first things one of my very first preceptors told me that if you want to stay in healthcare for long, you need to have two very important values. One is you need to have a lot of patience. Second, you need to have a lot of compassion for people, right? So I think that when, not just in pharmacy school, but when I go out and I counsel kids who are caught smoking, you kind of realize that what you see sometimes it's just on the surface. It's like an iceberg, right? Smoking is just a symptom of a lot of things that are happening underneath. And when you start to speak to them, you realize that you can't solve all their problems. And the best way to do it is to engage with other people who can fix their problems. Sometimes it's not just one person, but it's only through that experience that I realized that social workers do a lot of good work. Counselors do a lot of good work. Psychologists do a lot of good work. And sometimes the support they need is really a mentor or a coach, not even like a medical professional. So I think being open-minded to all these options, rather than when I first went in, all I know is the medical side of things, to be open-minded to a lot of other ways that can help someone. And I think I'll give another example, because working in community pharmacy, a lot of people come to us with questions on supplements and TCM and things like that, right? I never believed in that because that's not my training, right? We always train in Western medicines and chemicals. But at some point in time, you realize that so many people come and tell you that it helps them. So are you totally close to that idea that it doesn't work at all? Right. So then I started to realize that, okay, I might not understand it fully, but if these things have been around for like hundreds of years and they've helped so many people, maybe this is what gives the patient comfort. This is what gives the patient warmth. And if that's the experience that I want people to feel when they come into the pharmacy, to be warm, to feel comfortable, to feel that they have a sense of calm, I should be open that those are possibilities as well, at least to recognize that it might have provided some benefit to the patient. And that way, when you're more open-minded, you have more patience, you're more compassionate to want to actually help the patient. Life is easier, makes you much happier to go to work, right? Rather than think you have all the solutions. Sometimes they might have a better solution than you.
Yeah, thank you so much for that. I mean, all the sharings. I think like it really drives home the point about how like we really need to care for the patients from a personal level, rather than just seeing them as like statistics or numbers. In a sense, which kind of extracts a lot of that emotion out of things. I'm conscious of the time, so maybe I think like to end off this whole session on a very positive note. I think we've been talking a lot about the challenges we face, how we can improve in terms of our training, education, etc., how we can improve as future healthcare professionals. But are there any instances in your career journey? I know probably there have been a lot, but maybe if there was one thing that stood out to you about validating your choice in your career, maybe what would that be? And will you be willing to share that with us?
Validating. I think I have never have doubt in this profession.
Really, is that one thing that stood out to you a lot that like, like really tell you like, yeah, like because of this, this gives me the motivation to continue on to be a nurse or doctor or
Okay.
pharmacist?
So I think that is what I have learned from the early days I'm working in ICU. Like what Noel have mentioned, life is short. In fact, life is just a second, breathe in and breathe out. If you can breathe in, you cannot breathe out. That is end of life. So I think in the ICU, I have seen so many deaths that have taught me treasure every moment, treasure the people around me, because whenever I make mistake, I apologize immediately because I do not know whether I have that next moment to do the to say a apologize word. So I think that carries something. That's why there is one word. It's only death, then you live every day to the fullest. I think this is so true, because then whatever you have encountered, whatever the hardship you have experienced is fine. You experience the other people experience is a learning point, then you move on. You do not carry that burden along the way. That is what I feel. That's why if you ask me, I have faced a lot of challenges and obstacles. By looking back now, I feel it's my learning. I have learned a lot from that. Yeah, I think that what I can share. Yeah, thanks. Noel and Shah.
Noel, you go first.
Oh, okay. I can't. I think like Wen-Tao, I can't recall a single event or episode that results in us thinking that we have made the right choice. It's always a series of continuous reflections, as what Wen-Tao mentioned earlier, and like what Sean says, we always go in with this conviction and with all the mentoring that comes from people, or our ex-professors and all, that gives us this determination to carry on. I really don't have that single event, but I would then find that actually, for me, it's very simple, right? Day-to-day basis, when I wake up and I look forward to going to work, or at least I know that in the next few months I will be accomplishing something meaningful for whether it's for my patients in hospital or whether it's for the patients in the volunteer organizations that I work in. I think all these things will give me the energy and the motivation and the morale to carry on. And strangely, despite the pandemic being so depressing for most of us, that's especially the type of period. These are the times that healthcare workers have to stand up and guide and be the beacon of hope and light for our people. And I felt that throughout this pandemic, I didn't really feel that depressed. Maybe I'm by nature more optimistic. So that is for me a litmus test to know that if I can find opportunities during the pandemic to continue to grow, continue to improve, and continue to lead others, then I think I'm in the right place at the right time. So for me, it's just a simple evaluation that way. Thanks.
I would say a big part of my work has been a lot of reflection as well. Last time at the end of a work day, when I take the train back, a lot of people will use their phone, right? But I would have to sit down and very honestly ask myself, how did my day go? Like, what did I do well and what did I not do well? Sometimes I argue with a customer or a patient. Now you feel damn good, right? Because you win the argument, but you realize that if your aim is to help somebody and to provide them knowledge, they are never going to come back to you for help, right? So what's the big picture there, right? It's especially important if whoever is listening, if you're like me and your ego and your pride is up there, it's important to do this reflection. I think two parts I think are important in terms of like fulfillment and how I see things. On the outside, when I see a customer or a patient smile, when I see them get better, and sometimes it's as simple as when a patient comes in and asks me a question or sends me a message or email and asks me for more information, it gives me a sense that they care about their health. And if they care about their health, whether it's because of me or whether it's because some other professional did a really good job, I feel quite comforted at that. And yeah, sometimes it's as simple as that. And inside, I think if you're the kind of professional that relies a lot on external compliments and appreciation, I don't see a lot of that happening. People are not so expressive. I mean, I do have quite a few, right? But the large majority of them are not so expressive, and they come and tell you, "Thank you so much, you changed my life." Not really, right? And I kind of realized this only when I left full-time practice. So what I did was I was organizing a event in a secondary school, and I let all the kids learn how to do a blood sugar test, like those home test kits, right? And at the end, during recess time, their teachers, their principals, they all come down and they'll start to prick everybody to practice that skill set. And suddenly one of the students came to me and she tugged on my shirt. It's like, Mr. Ang, is this why you do what you do? So I'm like, what do you mean? Then it's like, oh, I poke everybody's finger. I also feel very happy. I was like, then it's at that point that it made me realize that, yeah, it's a chance to share some thoughts with her. Right? And I said, in healthcare, a lot of people don't openly give them our appreciation, but a big part of fulfillment actually comes when you give a part of yourself to somebody else, providing a service to somebody else. And if you can understand and feel that happiness in being able to make a difference in someone's life, no matter how small, yeah, you'll be quite happy going to work, realizing that is a possibility every day. Yeah.
Yeah, thank you so much for that. And I think like that brings us we can really close off this session very well. Or maybe I just want to open the floor. Anyone with parting words for our aspiring healthcare professionals who are going out into the workforce, any last words to say to them?
I think it's really to treasure the relationship. I always feel whoever you have met along the way, there is a reason for you to meet each other. So to treasure that relationship and then to learn from each other, that is what I feel is important. And you can do such things, but if you work with the other people, you can do much more things. Yeah. Thanks.
Okay, so for me is to tell everyone, please enjoy your life journey. Earlier on, we talked about the life being short, and so therefore, make this journey on Earth very worthwhile, and give meaning to yourselves and also your loved ones. And finally, also, I didn't have a chance to share about my failures, but just know that life is full of failures. Failures then lead to success. Success lead to hope. And maybe if you like, you can connect with me on LinkedIn and I can share more about my failures. Thank you.
I would say it's not easy coming into healthcare because you have to take care of your patient's emotion. You also have to take care of your own emotions, right? But when you feel really, really down, believe in your abilities, believe that you have a skill set that you are able to use to help the community, right? What you feel might be an everyday easy thing for you, to somebody, they've never seen it, they've never heard it before. It actually makes a difference. So believe in yourself, right? No matter how tired you are, realize that you are providing a big contribution. And for everything that you have gone through, I think be courageous, be willing to try new things, open up your mind. And sometimes I would say that if you are worried about whether you should do something or not, we have this concept that I always tell. It comes from this movie called We Bought a Zoo. And it says, if you have 20 seconds of insane courage, what would you do? All right. And with that, at that point, if you have 20 seconds of insane courage, how much risk would you take? What new thing would you try that you didn't dare to try previously? Yeah. And if you do something, I promise you, something good will come out of it.
Thank you so much to all our panelists. I think definitely very motivating and very inspiring for all of us out there. And so I think like that brings us very nicely to draw the session to a close. I just want to thank all our panelists once again, Dr. Noel, Dr. Joe, and Sean, for joining us today for this short 1 hour. And I hope that all our attendees have really benefited a lot from their sharing. As Dr. Noel said, please do feel free to connect with them outside this call as well. I'm sure they'll be happy to share with you their experiences further should you wish to learn more. Yeah, with that, I just want to thank everyone for coming once again and have a great day and great week ahead. Thank you.
Thanks,
you. It's a
Joel,
pleasure.
for the opportunity to let us know each other.
Yeah,
Thanks.
thank you. See you all.
Thank you.
Take care.
Thank you.
Bye.
Bye.